Radionuclide decorporation agents. Radionuclides may be internalized in the body as a result of inhalation, ingestion, or absorption through skin or wounds. Once internalized, they are distributed to various tissues. In turn, the tissue distribution of a radionuclide determines the pattern of injury observed. As a result, internal irradiation occurs, which is associated with a higher risk of stochastic radiation effects, for example, tumors. The goals of internal decontamination are to reduce absorption and to enhance elimination and excretion of radionuclides from the body. Treatment is most effective if it is started as soon as possible after exposure. The term decorporation agents refers to drug products that increase the rate of elimination of radioactive contaminants from the body. A blocking agent blocks the uptake of a radioisotope in the body. For decorporation of different radioisotopes, different substances are used. Some of the drugs I will be talking about are not approved under research or can be toxic, so before using them, please consult with a specialist. Don't use them because of a random YouTube video. And let's start from CESIUM. For improved decorporation of CESIUM from children living in radioactively contaminated areas, pectin was used as a food supplement. In the body, potassium and rubidium molecules interfere with the incorporation of cesium. In the USA, Prussian blue was approved for decorporation of cesium. It is marked under the name radioagadase. It can bind cesium, preventing its reabsorption from the gut and thus enhancing its elimination through the feces. It is also approved for decorporation of thallium. It can be administered orally and may be continued for 30 days or longer, depending on the level of contamination. Blocking of radioactive iodine. For blocking of absorption of radioactive iodine in the body, potassium iodide is used. It allows for saturation of metabolic processes in the thyroid with stable non-radioactive iodine, thereby preventing uptake of radioactive iodine. The recommended dose is 100 mg iodine or 130 mg of potassium iodide for adults. However, the time of administration is crucial. Stable iodine is most effective if given less than 20 hours prior or up to 2 hours after radioiodine exposure. It should not be administered later than 24 hours after radioiodine exposure, as this may even be deleterious by extending the presence of radioiodine that has already been taken up into the thyroid. Decorporation of strontium. Strontium is chemically and biologically similar to calcium and is incorporated primarily into bone following internal deposition. So in the body, calcium can interfere with incorporation of strontium. Alginic acid or alginate obtained from seaweed extract selectively bind ingested strontium in the gastrointestinal tract, blocking its systemic uptake and reducing distribution to bone in rats, while other natural polysaccharides, including chitosan and hyaluronic acid, had little in vivo affinity for strontium. According to research, whole-body retention of strontium in rats is lowered by oral administration of chitosan. Aluminum antacids are an effective treatment for reducing the uptake of radioactive strontium. A dose of 100 ml of aluminum phosphate gel given immediately after exposure decreases the absorption of radioactive strontium in the gut by about 85%. Aluminum hydroxide given in a single dose of 60 to 100 ml reduces uptake by about 50%. Decorporation of tritium. The excretion of tritium can be increased by forced hydration. Decorporation of plutonium and americium. Diethylene triamine pentaacetic acid, or DTPA, forms stable complexes with transuranium elements, and these complexes are renally excreted, thus decreasing body burden. Salts of DTPA have been used investigationally for the treatment of plutonium, americium, and curium internal contamination. Calcium DTPA and zinc DTPA, administered intravenously or by nebulizer, can bind many transuranic metals or rare earth elements and enhance their renal excretion. Decorporation of uranium. Uranium contamination in rats has been treated with oral sodium bicarbonate. Research has shown that 3,4,3 Li12 HOPO can form stable complexes with uranium oxide to increase uranium excretion significantly in rodents. Decorporation of cobalt. It was demonstrated in research that penicillamine can be a decorporation agent for cobalt in rats. Decorporation of polonium. Dimercaptopropylphthalamidic acid and dithiocarbamate chelating agents have shown efficacy as polonium decorporating agents in rats. That's all. Thank you for watching.